Okay, so hi everybody. My name is Natalie Phillips and I am in the BA Health and Community Services program. I'd like to begin by acknowledging that I am presenting from the traditional territory of the Neutral, Anishinaabe, and Haudenosaunee peoples whose historical relationships with the land continue to this day. Today I will be presenting about my practicum experience at the Schlegel UW Research Institute for Aging, also known as the RIA, and the School of Public Health and Social Policy skills, knowledge, and values I was able to develop during my placement. I also discuss some of the key highlights of completing my practicum and the BA program. The RIA is a nonprofit organization located in Waterloo, Ontario, that aims to enhance the quality of life and care of older adults through partnerships in research, education, and practice. One of the main priorities of the RIA is knowledge mobilization and conducting research in a method where it can influence policy and practice. The RIA also has education programs, creates toolkits for care settings, and are involved in creating community partnerships to implement new programs within the community. My role at my practicum was primarily to work on the supporting inclusion through intergenerational partnerships, better known as SIP, a new 5-year community-based project with the objective to reduce social isolation for adults with mild to moderate dementia and their care partners. A few of the tasks I assisted with were conducting an environmental scan and stakeholder mapping, adapting a dementia educational resource so that it was applicable for youth and could be delivered in an e-learning format, and supporting community engagement through preparing for, presenting, and participating in community advisory groups. My other role at my practicum emerged from my practice case scenario. Early on, I identified that the RIA is missing an equity, diversity, and inclusion policy and training for the main team members and researchers. I started discussing this with other team members and researchers who looked at cultural diversity and inclusion within care settings. After meeting with the Senior Director of Operations, we decided to implement my scenario, and I worked to develop this policy. This involved examining the RIA's current policies, researching other organizations' inclusion policies, and identifying training and writing a draft policy. This policy is currently under review by the leadership team. They're letting me know that it'll be implemented once the pandemic is over. The first skill that I used throughout my practicum was community development and capacity building. This was fundamental as my role in the SIP project involved engaging with the community at advisory group meetings to identify what resources already exist and what gaps there were in the Waterloo region. It helped us to discover what partnerships could be created to address social isolation and create sustainable programs. Written communication was developed through writing my draft inclusion policy and helping to create documents and reports, such as an environmental scan summary to provide to our advisory group. Oral communication was developed through presenting at an advisory group meeting and helping to facilitate small discussion groups with youth during our adaptation of the dementia education program. Basic policy development was a crucial skill that guided my practicum as I worked on creating and implementing an inclusion policy. This is done through the process I described previously in my practice case scenario. And finally, cultural safety and competence was another skill I developed through my practice case scenario. Within the policy, I've included a subcomponent for cultural safety, recognizing the importance of defining inclusion for Indigenous peoples. Based on time, I just want to briefly touch on one value and knowledge that I developed in the practicum. Collaborating actions across all sectors involves communication and coordinating work between sectors, such as government organizations, nonprofits, community advisory groups, and other important stakeholders. This value was an important component during my practicum, as SIP is a collective impact project, which Paul Bourne has defined as bringing people together in a structured way to achieve social change. Collective impact projects need to involve at least 4 main sectors: community organizations, business leaders, government leaders, and those with lived experience. I learned the importance of creating an advisory group that had members from all of these sectors. It allowed me to understand and witness how collaboration could occur when these sectors had an environment to engage with one another to identify the gaps and needs of the community. The knowledge area, improving health and reducing health inequities, guided my initiative for the inclusion policy and training, as I've recognized that discrimination and exclusion has caused health inequities to exist, and this must be addressed to improve the well-being of Waterloo region. One of my most meaningful components of my practicum was the team I got to work with. They were supportive of me taking on my own initiative and were open to teaching me any skills or knowledge I identified as important to develop. I'm also very proud of the policy I created for the organization and that it will be implemented. I feel as though I was able to contribute a lot to the RA and the SIP project. The BA program and the practicum had a huge impact on me professionally and personally. It helped me to discover my passion for knowledge mobilization, reducing health inequities, and increasing healthcare accessibility. I also developed an awareness for health literacy and have recognized its importance in influencing health outcomes. This program has really made me feel like this is the right direction for my future. So I just wanted to share this photo of the community advisory group and the SIP backbone team from our SIP media launch event. And just wanted to thank everyone I had the chance to work with for the opportunity and their support throughout my learning in this process. So thank you for listening to my presentation.